Hi friends, so today we are continuing our congenital series and we are discussing about the lower limb problem. The lower limb, like foot is having an extra cleft, a cleft which is there in between the toes through the interdigital space, and it goes beyond and beyond and just beyond, and it causes the deformity in the lower limb, especially the feet. So it's been explained in Abraham classification. There are three types in Abraham classification about the cleft feet, which is also known as acrodactyly or lobster feet. So type 1 is in which this cleft, which is starting from the interdigital space, because the central rays are deficient, so this cleft reached up to the metatarsal or mid of the metatarsal bone, and the specific thing, there is no splaying between the lateral and the medial rays. Those are quite together. In type 2 Abraham, this cleft is going beyond the tarsal bone, just up to the tarsal bone or there. So there is splaying in the forefoot between the medial and lateral rays. This is type 2 Abraham. And type 3 is in which there is complete absence of the first ray, and this is the deformities between the third and fourth rays. When you are seeing this cleft foot deformity, there are other associated problem as well. There can be cleft hand, there is a ridge between the toe, this interdigital space. There can be cleft lip, cleft palate. There could be tibial hemimelia. There could be urinary tract abnormalities. There could be the deafness. So these are the congenital deformities. These are not alone. Usually these deformity comes with some expressed form, like in which you can see the cleft hand or cleft lip, and something which is not clear, which you came to know later, like the urinary tract abnormality or the tibial hemimelia. So the main problem in these deformity is difficulty in the cosmesis part is difficult, and the second problem is difficulty in wearing the shoes, the normal shoe. So the aim of treatment is to make patient in such a way that he or she can wear the normal shoe, and it should be painless. So type 1 Abraham, we do the soft tissue syndactylism, and if it require, we do the hallux valgus correction if it is there. In type 2 Abraham, we do the soft tissue syndactylism, and if the age is less than 5 years, we do the first ray osteotomy. If the age is beyond 5 years, then we have to remove this first ray, the amputation of the first ray. Normally in type 3 Abraham, we do no surgery. We are not going for any surgery. So this is about the cleft feet, and the problem that the main concern is cosmesis and difficulty in wearing shoes. So I think you are liking our series. Please like and subscribe. Life Care. Thank you.